In the end, we called a human surgeon. The second surprise was when I extracted a kitchen knife, 25 centimeters long, with the handle in the stomach and the blade in the esophagus. I knew if it chased me, it would be on its front legs, and I would manage to get away.
What case from work do you particularly remember?
People came in with a Labrador puppy. 3 days ago, they noticed he swallowed something. According to the owners, it was a small cloth for cleaning glasses, identified by its color. Considering it's a soft material, we decided to induce vomiting. Yes, it came out, but it wasn't that cloth. It turned out to be a huge piece of, can I tell it on camera? Underwear. They took their pet to the countryside. The dog was in heat, and they left their beauty with the grandmother for just a couple of days. Then something unclear happened, and by the timeline, you can already tell if the animal is pregnant or not. They come in saying, "We need to check for pregnancy." I say, "Okay." I ask, "Was the pregnancy planned?" They say, "No." And the dog is lying there. I do the ultrasound and say, "Congratulations." And they to the dog, "Oh, you? How could you? What are we going to do with you?"
I went to a zoo, and during the transfer of cages, an orangutan, I believe, broke its leg. It was a small monkey, a child. We did an X-ray, consulted with other doctors for a long time on what anesthesia to use, how to properly perform the surgery. In the end, we called a human surgeon, administered anesthesia to the animal. Well, we did the X-ray, confirmed the need for surgery. I still remember this little creature. He was truly amazing. He sat curled up in a blanket, extending his leg and touching everyone's finger. Whoever stretched out a finger, he touched it. He didn't like everyone, but that's how he greeted them all. We had a case with a 9-month-old French bulldog experiencing periodic vomiting over 3 months. After conducting an X-ray, we were surprised to find a household item in the esophagus. We discussed that surgery was necessary to investigate further. The second surprise was when I extracted a kitchen knife, 25 centimeters long, with the handle in the stomach and the blade in the esophagus. How it got there, how he lived with it, remains a mystery. The last animal we treated, truly exotic, was a lion weighing about 300 kilograms. We performed spinal surgery due to a compression fracture in the lumbar area, causing paralysis of the pelvic limbs. As an anesthesiologist, I, along with a colleague, kept the animal under anesthesia. We prepared for about a week, gathering information. I found articles from our African colleagues who had worked with such animals. The lion wasn't tame. They distracted it with food near the cage while I sneaked in and injected its hind leg. I knew if it chased me, it would be on its front legs, and I would manage to get away.
Why did you not want to become a doctor who treats people?
I wouldn't want to treat humans because people often lie. The patient-doctor relationship isn't always perfect. With animals, it's much simpler. If an animal doesn't trust you, if it doesn't like you, it will surely show. If you help an animal, provide aid, they truly understand you wanted to help. I never wanted to treat humans. People lie, and then it's hard to get to the truth. I'm the head doctor at the clinic, and recently one of the doctors asked for help with a diagnosis. Entering the office, I saw a couple with a small dog on their lap, showing standard symptoms of gastrointestinal upset. But the owners didn't reveal anything that could have caused it. They claimed the dog was regularly treated, ate only pet food, lived a healthy lifestyle, and walked 3 kilometers in the morning and evening. After questioning, several facts emerged, enough to make a diagnosis. But I was just curious how much they lied to the first doctor. In about 10 minutes, I extracted a completely different history than what the previous doctor had collected, who hadn't tried to unearth the truth, but simply inquired about the pet's care.
How do you feel when an animal cannot be saved?
Emotional exhaustion. Seriously, every patient weighs on my soul. And if someone dies, it's very hard to continue. But you switch off emotionally and just work as a doctor. A doctor must work. If you take every case to heart, especially those you couldn't save, you could indeed go mad. So, you develop defense mechanisms like black humor and a semblance of callousness, among others. Deep down, you really care. Get anxious. Scour literature afterwards. sit and think. Maybe there was something else I could have done, something I didn't know. On one hand, it's all very sad and bad, but on the other hand, it pushes you to improve.
How do you feel about euthanasia?
Euthanasia helps relieve suffering for animals we can't treat and who are in significant pain. Many times, pet owners have approached me wanting euthanasia for non-objective reasons. I refuse.
There was a turning point for me when people came in late at night with an old cat suffering from lung edema. It was very old, in bad shape, struggling to breathe. Its behavior screamed, "I'm in pain." We tried for a long time, probably 3 hours in the clinic with those people. But there was no response from the body to anything we did. I couldn't outright tell the people, "Let's do it." I always try to follow the tactic that if there's positive dynamics, we'll keep supporting until you, the owner, have the strength and the animal is doing well. But if we see a decline in indicators, a worsening clinical picture, we eventually have to come to terms with it.
Managing a disease in your pet, especially one with chronic illnesses just like humans, which are quite numerous, I believe, is a feat. I always bow my head to people who manage such pathologies over the years. And sometimes, when it comes to euthanasia, it's about alleviating human suffering. I attended courses on how to properly communicate with owners about such matters, and they didn't tell me anything good. They just said, approach and speak. It's routine, nothing special. But when I look at people, especially those who truly love their animals, approaching someone and bluntly suggesting to put their dog down, I think, won't be productive.
Do you treat stray animals?
Animal rights activists often bring stray animals to clinics. Probably, these are some of the most challenging patients because there's no history of how the pet was kept. We don't know where it has been, what it could have eaten, what injuries it might have sustained. And every time you try to figure out how to help the animal, you never know where to start.
We conduct what's called a diagnostic nightmare for animals. This includes all diagnostic procedures we have: X-rays, ultrasound diagnostics, cardiology consultations if needed. If we identify additional diseases related to specific specialties, we refer them to the relevant specialists. We have narrow specialists in various fields.
There are many such animals, but probably it's necessary to differentiate. There are dogs, there are cats. Currently, dogs don't have viral diseases. It's quite a rare occurrence. Cats, however, suffer from chronic viral infections, which are numerous. Often people who pick up animals from the streets unknowingly adopt sick animals. Many viral infections in cats are untreatable. They are just managed symptomatically. Pathologies can be quite serious. Airgun injuries, hit-and-run animals often come in. Such patients, usually in shock, usually arrive in an unstable condition. When an animal is found not within city limits but in rural areas, there's a risk of rabies. Like when people drive and see a fox standing or sitting on the road. It's an abnormal situation. You must not touch it or do anything with it, because if a person gets infected, they might not receive help.
Do you treat your pets yourself?
I have a rabbit and a chinchilla. They don't get sick.
I have a dachshund. I found her in another country. But I'm among those owners who believe she's not a daughter, not a son, by no means. She's a pet, an animal, but love is love. I recently had her sterilized. From my clinic, I picked a team from all shifts. My anesthetist, my surgeon, those who would assist. And only then, with full confidence, I proceeded with the surgery.
I have a pet. One is called Kant, a cat. I took him from animal rights activists. He had a broken leg from childhood, which wasn't properly fixed. He limps a bit, that's his quirk. I have a dog, an Alaskan Malamute named Banya. About a year ago, I noticed a small tumor in his mouth, immediately flew him to the clinic. On the first day, my dog underwent all necessary examinations, and the next day, he was on the operating table. I really couldn't do anything. I couldn't hurt him. I asked another doctor to remove the tumor, although I'm also an oncologist and should have done it myself. I only gave recommendations on what to do and how to proceed in this situation. I have a cat, picked up from the street. Being greeted at home by someone, those tails wagging, yes, it's really cool. It lifts your spirits, a nice little relief, despite the fact that we see them every day at work in countless numbers.
Do owners interfere with the examination of their animals?
Unintentionally. Owners can't interfere on purpose. They might interfere simply out of their misunderstanding. But there's great love, in reality. Often, the owner helps. But in some cases, when you proceed to examine the animal, it might behave differently in the presence of its owner than you'd like. They might whine, ask to be picked up, try to bite, or not let anyone near them at all. As soon as the owner leaves the room, it's as if the dog or cat has been switched. It stops constantly looking back at the owner who was in the office. It starts exploring the office. You can perform some procedures with a much calmer animal than in the presence of its owner.
I'm sure any pet owner, getting a cat or dog, doesn't think about the possibility of them getting sick. It's just not something people tend to think about. We get pets to love, feed, walk, care for, bathe, brush, etc. So when owners are faced with such a situation, especially if it's something serious, it's impossible to control emotions.
For veterinarians, Google is one of the most common problems, just like other search engines. Because people look up symptoms, find some scary diagnoses. Some of them I don't even know myself. And when someone comes to me saying, "I know what my cat has and you're going to confirm it," I get scared. I recall horror movies, and I understand that now I'll have nightmares about it.
Dear owners, come in. We'll always talk to you, advise on food, recommend preventive measures. We're happy to see you every year.